Type 2 and type 3, which we have chosen to call this mechanical versus inflammatory. The mechanical ones are the ones who get an anesthetic response but no corticosteroid response. In other words, yes, we've injected the right level, but it does not appear to be, and we know that the cortisone has been delivered to the same place, and so there's no corticosteroid response. So it's not inflammatory because cortisone will stop the inflammation like that. It really does. And it does that very, very powerfully for at least 2 weeks. Okay. I mean, it takes 2 or 3 or 4 weeks for that to be completely metabolized and washed out of the system. So you're going to have a corticosteroid response for 2 or 3 weeks. All right, at least. So at 1 week, which is when we did the follow-up, if you don't get a corticosteroid response in a week, you're not going to get it. If the patient gets better over the next several weeks, that's not enough because they might be getting better anyway. All right. They have to have, usually you'll start to see a corticosteroid response within 48 hours. The patient will notice the improvement, quite rapidly within 2 or 3 days. And by a week, the corticosteroid response is at its maximum effect. Right. So if you get an anesthetic response, you can say, yes, the prolapse disc that we see on MRI is relevant. And no, it's not inflammatory. It's mechanical. Okay. It's pressure or tension on the nerve root or the dura mater that's causing this.